What would you do as the parent of an adolescent child who suffers from attention deficit hyperactivity disorder, ADHD, and you discovered that their social media consumption was predominantly pornography? Welcome to Talking Psychiatry. In this episode, I will be in conversation with Linda Kelly. Linda is a subspecialist child and adolescent psychiatrist, and she recently published an article in South African Psychiatry in the March 2026 issue entitled ADHD and Pornography in Adolescence. Let's join Linda. Linda, great to see you. So glad you could make it. We've had our little technological issues, but you know what? We're here. And technology is as beautiful as when it works. And when it doesn't, creates a lot of stress. So thanks for joining me. Welcome to Talking Psychiatry.
Nice to see you, Chris. Thanks for inviting me.
So we're going to get straight into it. I mean, we've got a very interesting combination of issues here. Adolescence, attention deficit hyperactivity disorder, and pornography. So you bring the three together, it's quite a potent brew. But I want to start out, adolescence. You know, I mean, you and I worked together in the adolescent at Tara many, many years ago, and I spent many years doing adolescent psychiatry, which I really enjoyed. But this whole issue of defining adolescence, because I think it's important to get our terms of reference. And there's some who have previously said that adolescence should be its own special area as a subspecialist discipline, like the area of adolescent psychiatry. But put that to one side. Your thoughts on how one defines adolescence?
Well, I guess first of all, there is the sexual maturity and physical maturity side of it, and then obviously emotional side of it, and then the cognitive side of it, and it's sort of the interface between childhood and adulthood, and a lot of vital development takes place across all those domains, and it's a time of great neural pruning and connection making and identity. So it's a very important time.
Well, it's for some, it's quite a tumultuous time, and there's a lot of vulnerability because as you're describing the process of moving from childhood to adulthood through adolescence, this is a particularly vulnerable phase. It's not to say that other phases aren't. But you know, the interesting thing for me was always that as much as adolescence is seen as this tumultuous, turbulent time, most adolescents actually negotiated quite successfully. And even with the most troubled adolescents, was always quite impressed with their thoughtfulness and their ability to actually engage. Not always, but generally. So some people use an age cutoff. I mean, how realistic do you think that is? You know, sort of between 12 and 17. Is that viable, or are we looking at something that is much more extensive in that sense?
Well, I guess it's to do. I mean, you'd have to see in what sort of parameters you were using, because I guess teenagehood, adolescence could be 12 or 13 to 18 or so. But again, it would have to boil down to maybe connecting puberty and development to it as to when you've reached the final stages of puberty. And then I also guess brain development, which, as we know, prefrontal cortex development is even later into the 20s.
Exactly. And exactly. And I suppose that's my point, is that this whole issue of development, you know, when one puts an age bracket on it, I think you're missing a lot of what is taking place in terms of developmentally. So that's adolescence. I want to touch on attention deficit hyperactivity disorder, ADHD, and you very nicely in your article highlight the three critical components. Do you want to walk us through those just for terms of reference?
Yes, sure. So the core symptoms encompass the inattentive type symptoms, the hyperactivity symptoms, and the impulsivity symptoms. And along with this, there's a big association with emotional dysregulation, which some people say should possibly be included in the diagnostic sort of description of ADHD because it's that common. I sometimes think of it as emotional impulsivity. So the dysregulation is caused by emotional impulsivity. Yeah.
Well, carry on.
No, no, yeah.
Okay, so because I was looking at the signs of inattention and impulsivity and hyperactivity, and what struck me was that, I mean, there's 18 of them actually when I look at the illustration or the graphic representation. And I thought any one of us at any particular moment can manifest any of these things, and we don't have ADHD. I mean, stress, for example, can lead to inattention, not focusing, restlessness, agitation. So how does one say, this is ADHD, this is something else? I mean, you're always looking at context, I would imagine, when you're making a diagnosis.
So definitely context and certainly number of symptoms too. And also around how much they affect functioning and if they occur in more than one setting. Because if it's just occurring in one setting and not occurring in another setting, does that make it a sort of a global symptom, or does it make it something that's situation specific? So really it comes back to the same as a lot of DSM conditions do. It's about dysfunction, it's about quality of life, and how it impacts the person.
One thing that always struck me with adolescent psychiatry is that context was so important. I was always looking to see, okay, we've got these symptoms. One can make a tick box diagnosis if you isolate them individually, but what's the context? And I think for me, that was always very important. And I think you're raising that issue. Where do these symptoms happen? Predominantly here or there? And I think that's very important because, I think that's the issue of the simplistic tick box approach versus the clinical approach, where you actually get into, okay, so let's get into the background. Let's get into the context. So I was looking at figures. So one of the other issues that struck me with ADHD is this movement from childhood onset into adolescence into adulthood. So there's this kind of spectrum of age. So it's, stereotypically, I mean, back in the day, it was a childhood condition. I don't recall that when we worked at Tara in the adolescent unit that I ever diagnosed ADHD. And I'm thinking to myself, either we missed it or it's emerged, but then it's kind of moved into the adult area as well. So your thoughts on this spectrum of age involvement?
Yeah. I mean, obviously, it's a neurodevelopmental condition, and it's one of the most genetic of all of the child psychiatry conditions. So it's highly genetic. And it is not something that just disappears. But I think what you see is that there's a difference in symptoms across the age groups. So in the younger children, you often find more hyperactive, impulsive sort of symptoms. And then as you move into older children, those tend to get better. Not always, but, just as a generalization. And then by adolescence, what you find is that the symptoms are sort of, but you can get both, but often the hyperactive impulsive symptoms are less obvious. And it's now more the inattention, the disorganization, the procrastination, the executive functioning deficits, which then really, really affect high school. And then you move
Yeah, and I
into
think
adulthood.
that's where, yes,
Yes. And I mean, there
carry on.
again, it can affect secondary studies. Because it's again around those executive functioning deficits which remain. If you have intervention, you may find ways of managing them, or becoming a person who keeps lists and has alarms on phones and that sort of thing. But if you haven't done any of that, you remain very much disorganized. Procrastination is a huge issue. Impulse control then looks different in that it might lead to things like substance abuse or risky behavior. And in the context of this article, obviously sexual behavior too.
Yes. Well, I think that's what's really evolved in terms of our understanding, is that it doesn't just simply disappear and end and then you're okay. Because I think that was always the kind of traditional thinking, and it certainly evolved. And that's where I think with adults we speak more about ADD, attention deficit disorder, because of those changes that take place over the age span. But I mean, I was looking at background figures. I always like to look at, well, what is the extent of the problem? And American data from the CDC, Center for Disease Control, 11.4% of US children aged 3 to 17, 7 million. That's a large
It's a
number.
huge.
with
It's
diagnosable
huge.
ADHD. And
Mm.
I think that
That's
one
huge.
of the issues for me has always been, are we overdiagnosing it? Are we over-medicating it? And certainly in certain settings, one sees a push for diagnosis and treatment. And I just wonder what your thoughts are there. And I'm speaking without any bias one way or the other, just looking at the numbers and saying, wow, that's a lot.
Yeah. Yeah. I mean, I think the net has been thrown quite a lot wider in terms of symptoms. I mean, at one point it was the traditional hyperactive, impulsive child, boy, all over the place, couldn't sit still. That was the sort of stereotyped picture. But I think that as it's become more understood in terms of the executive functioning stuff, more girls have been picked up, and more people who
Right.
maybe wouldn't have been seen as impulsive or hyperactive, but that inattention has become something that there's more focus on now, the inattentive symptoms. But it's still, the numbers are big. Um, and obviously, there's a lot of comorbidity that goes with it, both in childhood, adolescence, and in adulthood. And sometimes that comorbidity needs treatment in its own right first before you make a diagnosis of ADHD, and sometimes the other way around. If you treat the ADHD, you may not need to do others. Um, so I think the numbers are big, and they're even big in adults. I mean, the adult ADHD has exploded as people look back
Yes.
and say, had these symptoms my whole life. I've never reached my potential. I've always been disorganized. I get bored easily. What would it have been if I had been diagnosed earlier?
Quite interesting. Well, exactly, because obviously psychopathology during adolescence clearly affects the developmental trajectory, and where that takes you from where you might have been is potentially very significant. One of the issues, I came across a review article that was looking at persistent ADHD into adulthood from childhood, and there they were looking at global figures of a prevalence of 2.58%. Symptomatic ADHD, where it emerges irrespective of childhood onset, was in the region of 6.76%. And when they translated that into numbers, the persistent ADHD, we're talking about 139 million people globally. And for the symptomatic ADHD, where you didn't have to have childhood onset, 366 million adults globally. So just to sort of add to what we're saying in terms of the numbers, and when you kind of look at those numbers, yeah, I often find it difficult to get my head around that in terms
No,
of
I
of
do
the
too.
extent.
Yes,
I'm
we think
sure.
this is a neurodevelopmental condition. How is it possible that it didn't present before and now is presenting in adulthood? And are we actually treating something else? A cognitive deficit or a depression or is it something
Yeah, no,
else?
no. I think that's a perfectly valid question. It's not that we're being cynical, but we are looking at it and saying, this doesn't quite add up. And what is actually going on and why now? At the end of the day, so, one has to look at what's changed, our diagnostic ability, our awareness, or is there something more fundamental that has maybe changed in our society, in our culture, in our environment? But
Yeah.
we don't have the
I
answers,
do
but I
think
think
so.
they're perfectly, they're, they're
We've got
perfectly,
one big thing that's changed, and that is access to screens,
yes,
embedding of digital media into brains and lives.
yes.
That is a huge, huge change. And I think it's
Well,
very significant.
I think that is profound, and I think we're going to go there slightly deeper into the conversation because I want to focus on social media and the impact and what we're doing to ourselves at the end of the day. So it's kind of interesting that you go straight there. Well, not it's I think spot on. That's really what has changed. Never mind the internet; it's moved beyond the internet. It's like access in your hand.
Yeah.
So the issue of pornography. And because I'm sort of bringing all of the different elements, each one independently, to build towards bringing them all together. Widely available, accessible, unprecedented, actually almost normalized. Is there an actual definition of pornography, what it is these days, or your
Yeah,
thoughts
I mean,
on
I think
that?
there's been a bit of the researchers in the field have battled to find consensus, but essentially it refers to sexually explicit materials such as videos, photographs, or writings whose purpose is to elicit sexual arousal. I mean, that's the sort of
Okay.
basic definition. But and as you said, it's widely available now with this access on screen.
Well, I'm looking at the various forms, and I'm going to age myself a little bit. I mean, here in South Africa, for us, Scope. Scope magazine used to be the, where you had the lady in a bikini as the centerfold. Things have certainly evolved since then, but I can remember my folks went to Malawi and Scope was banned in Malawi. We're talking back in the 70s and 80s. And of course, the same with movies. You know, people used to go to Swaziland to go and see the original Emmanuel and Last Tango in Paris. And I mean, things
Mm.
have really moved beyond there, from what one might call erotica and maybe soft porn at best into hardcore. And there's all kinds of stuff out there. And I think we're going to look at what the impact is on the developing brain. So that brings me to adolescent sexuality, because obviously I think now
Yes.
we're sort of starting to get into what is going on with the adolescent sexually and in terms of their sexuality during this
Mm.
developmental phase.
Mm. Um, I mean, if we are we talking specifically about those with ADHD or those without? Although, I
No,
mean, a
no,
lot of
no.
the
I think
research has not really found a difference between the age
no,
of
no.
puberty and children with or without ADHD anyway.
Sure. I think just to sketch the sort of general picture of adolescent sexuality, and there's a reason why I'm actually talking about that more generally, and we'll get into ADHD, but just generally,
Mhm. In terms
what
of
is
adult sexuality?
well, adolescent sexuality? I mean, they're going
Adolescent
through
sexuality.
these.
Sorry, yeah. I
Yeah.
mean, obviously, it's something that develops in the context of where the adolescent lives, and it has to. I guess it's couched by what the family values are, what the um, societal values are wherever they live, and that obviously incorporates culture and that sort of thing. Um, and it's complex thing in terms of it's both neuropathological, it's as I've said, social, and it's environmental, and you can't really disentangle those because it's all of those that affect the specifically the I guess the psychological, but also the behavioral changes that occur with it,
Well, I think
and the
obviously. Sorry, Linda, carry on.
and the thinking around it too.
Yeah, sure, exactly. So, I mean, the bodily changes are what people would necessarily be thinking about. And I mean, certainly, for
Hmm.
example, in anorexia nervosa, there are issues that have been seen as potentially causative around maturity fears and the evolving female body and menstruation. So certainly, I mean, these are aspects. And then, of course, the self-awareness, as you've mentioned, the cognitive, the thinking, and it's not always comfortable for the individual in terms of their changing bodies, and then the emotional, which also comes into it, the changing roles and this emerging sexual identity during adolescence, which is not always easily adapted to. And then, of course, as you're saying, the context. What is the broader socio-cultural context? So there's a lot going on at that time. But let's talk about ADHD and sexuality. And does ADHD have a particular impact or not in terms of adolescent sexuality?
Doesn't seem to. They, in the studies that I looked at, there was no difference between the age of onset of puberty in children with and without ADHD, and there didn't appear to be an associated delay in or impairment in sexual maturation in ADHD. Um, I think that there is a general perception that possibly psychological and emotional development might be affected by ADHD, but that would then include sexual identity and functioning as part of that psychological development, which may be
So there
more
has been a
delayed. ADHD.
So there has been a sense that males with ADHD who are a little bit more anxious in terms of their attachment to others, they've got maybe some interpersonal issues, might be inclined to make more use or consume more cyber porn, which then obviously further impacts on their ability to form meaningful attachments later on.
Yeah, there's quite a big study that looked at that. But that was more in young adults than adolescents, from what I can recall. And it's, if they use it as a self-regulating and almost like a self-help kind of tool. That was what the article said, that it's in some way helps them in the moment, but it doesn't lead to further healthy attachments.
Well, I do think that's kind of interesting because the issue of hypersexuality in ADHD apparently can and does occur. But as you've just said, there's a kind of a potential self-soothing, a self-medication that is emanating or the consequence of that kind of behavior. So it actually serves a purpose for the individual, not necessarily a functional one, but it does serve a purpose.
Yeah, yeah. And I mean, I think the fact that a lot of sexual knowledge is probably gained from watching pornography, which doesn't necessarily portray normal sexual behavior. It often, it makes it quite idealized or extreme or dehumanized, etc. And it doesn't always represent what real sexual intimacy is like. And if that's where you're getting your knowledge from, it affects how you behave sexually.
Well, I think that that's a very important issue. You know, how are adolescents acquiring their information, and how does that impact their understanding of how human sexuality actually works? But before we get there, because I do want to come to that specifically, the issue of hypersexual behavior and compulsive sexual behavior disorder, because you mentioned that, and that
Yeah.
comes out of ICD-11, International Classification of Diseases, World Health Organization. Your comments on that condition and how, and we'll get into whether it relates to ADHD in adolescence or not.
So in ICD-11, they are proposing compulsive sexual behavior disorder, and they've included it in the impulse control disorders rather than in the addictive disorders, based on the fact that there is distress or impairment in functioning. But there has been debate as to whether it should be considered as a behavioral addiction, such as substances, gambling, shopping, that kind of thing. But for now, they've included in impulse control disorders rather than addictive disorders. And then the hypersexual disorder was considered for DSM-5, but ultimately rejected. And that is conceptualized as a sexual desire disorder characterized by increasing frequency and intensity of sexually motivated fantasies and enacted behavior.
Okay,
But it
so
hasn't
with
been included in DSM-5.
No, DSM-5 is kind of interesting. Diagnostic and Statistical Manual, the 5th version from the American Psychiatric Association. They have, and it's kind of interesting because I was looking at it, they kind of bifurcate male and female. And so for females, you've got a sexual interest or arousal disorder, so they're going in the other direction. And for males, it's a hypoactive sexual desire disorder. So they do touch on sexual desire, but not in the increase. It's more in the other direction, which is kind of interesting. But in terms of compulsive sexual behavior disorder, repetitive sexual behavior, and I think very importantly, can't control it, neglects other aspects of life, and it continues despite adverse consequences. So I think that's one of the issues, is that the person simply cannot stop, no matter what is going on.
Which then sort of sounds a bit more like an addictive disorder, so it's quite, it's definitely
Exactly.
bouncing between the two.
Well, I think what's interesting about that is that how one understands it potentially impacts on how you manage it. So when we touch on the neurobiology, which I will, that issue kind of comes up for me. But there was a
Mm.
study or a paper published by Hale in 2022 that you reference, and certainly in under 21s with ADHD, a 5 times higher rate of any hypersexual disorder. So it certainly seems that there is a link between ADHD below a certain age, or maybe beyond a certain age, but certainly in that paper, and an increase incidence or prevalence of any kind of hypersexual disorder.
Yeah, yeah, compared to those who don't have it. And that then makes you have to start thinking about what the differences might be and what the factors might be that
Yes.
lead to that. Yeah.
Well, I think one of the consequences, which now starts to bring us where we put everything together, is the use of problematic pornography, which certainly in that group who have ADHD, adolescence, one of the consequences is the use of problematic pornography. So there seems to be no question that an adolescent with ADHD is potentially more vulnerable.
Mm. Yes, definitely to all sorts of addictions in essence. Yes,
Okay,
a lot of
so,
sort of behavior, a lot of uh, dopamine hits, as they call it.
and I think dopamine is a critical neurotransmitter, and we'll be looking at some of the brain areas. I'll just touch on those when we get to neurobiology. But just this whole issue of unlimited, unmonitored, portable access to pornography and the emergence of pre-adolescents who are actually accessing this kind of content. I mean, that is really troubling. And I'm not
It's really
coming at it from
troubling.
I mean, it's just something that should not be happening. It's as simple as that. If one looks at what sexuality is all about and how it should emerge at an appropriate developmental time, you've got pre-adolescents accessing this
Yes.
information. And I think, yeah, that is particularly troubling, and how it impacts on emerging sexuality. And I think you've
Yeah.
touched you've touched on that, because I mean, fantasies and thoughts about sex emerge quite naturally, wouldn't you say, from
Yes.
pre-adolescence into adolescence?
Mhm. Yes, but yeah, no, definitely that. But if you are an 8-year-old or a 9-year-old, which is one of our colleagues who works in this field says is the average age of children accessing pornography now, it's very frightening. They are in the sort of latency phase of childhood. Mostly, they're not even in puberty, and they're seeing things which are not understandable to them at all. But then, obviously, will shape a lot of thinking and behavior. I see it quite often at this age, which is very frightening. Because once you've seen it, it's the impact that it has on thinking and cognition is extreme. And how do you unsee it? How do you not know it?
I think that's the issue, right? You've opened Pandora's box, and as we know, classically, once it's open, it doesn't close. But I mean, just going into your experience in terms of what you've seen, my immediate question is, what is the context? Diagnostically, why are the children presenting to you? And what is the socio-cultural family context of a youngster who's accessing internet pornography or accessing pornography at such a young age? I mean, for me, I'm curious.
I mean, I think it comes back to screen time management and supervision. And as much as there's talk of it, and there's various social media lawyers who do talks all the time about screen safety and online safety, it's quite gobsmacking to me how often I find that parents are not doing this, and it is almost a babysitter or a way of, oh, but it helps them regulate and it keeps them calm and that sort of thing. But This is exactly the kind of children who then access all sorts of things. Even on kids' YouTube, there are pop-ups which can take you down a rabbit hole. And if you just keep clicking, you can end up on a porn site. It's not hard. I had a little girl of 4 who was on her mother's phone, and she pressed Barbie, and it ended up in Barbie porn. So, and then she was 4. So it's you don't have to be savvy or smart. If you just follow the rabbit hole, it's easily available. And I don't know that parents always realize this, and I don't think that they maybe put enough, net nanny or screen restrictions on so that this can't happen. But
Well,
it's a huge.
gonna mention a psychologist. He works at the Stern Business School for New York at New York University, Jonathan Haidt. But I'll touch on him
Yes, I've
in
read his book.
a yeah, that's right. It was published in 2024. It was called The Anxious,
Mm.
or suddenly
And
it's escaped my
the anxious generation rewiring our
the
brains.
The anxious generation, exactly right. So, I mean, the whole issue with the internet, I mean, the internet's a double-edged sword. On the other, on the one hand, it's a trove of information which gives you access to so many things, but it's also access to other things that maybe are not appropriate depending on the age, or maybe not appropriate at all. And I'm not sitting in judgment or moralizing,
Mm.
but you've mentioned something, the dehumanizing quality of pornography and the objectification of the body in terms of pornography. Do you want to comment a little bit on that in terms of what it might represent versus actually how it should be between consenting
Yeah,
adults or consenting
yeah.
humans?
I mean, I think that because these unrealistic and often, as you say, dehumanizing or extreme forms of sexual contact are witnessed, it sort of leads towards children or adolescents developing sort of unrealistic attitudes as well, where it's absolutely fine to go and, find anyone, another, as I said in the article, where it's casual and physical as opposed to affectionate and relational. And we see that a
Yes.
lot. I think, that's how it's portrayed. You hook up, you move on. It's very much more prevalent, I think, than it was a couple of decades ago. I mean, I might be speaking completely out of turn, but that's my impression.
No, I think that's correct because one hears the stories and one understands what goes on. We hear it through our patients. We hear it socially. People comment on things. And I think the important issue here is that we're not sitting here as moral arbiters and saying what's right and what's wrong for consenting
Mm.
adults. We're talking here about children and adolescents, and we are commenting on the potential impact of exposure to something which may have deleterious negative consequences going forward. And I think that's the issue, because there is an impact. And I mean, you actually outline several consequences. So we're not just saying, well, we think it's a bad idea because, it doesn't sit well with us. There are actual documented consequences. Maybe you want to walk us through some of those because you capture them in the article.
I mean, obviously, it can lead to more early onset of sexual activity for one, and more high risk sexual behavior, and also more related with sexual aggression, where that might not have been a thing. You might not have conceptualized that. Um, there also seems to be an inverse relation between social interaction and bonding with other children. And that comes back to the Hale article again, with the consumption of sexually explicit material. We also see, and I see this a lot, emotional maladjustment, depressive symptoms, delinquency, yes, but also sexual acting out. And I can think of one case recently where there's a lot of sexual acting out very inappropriately. And I mean, this child is going to be excluded from the school because they can't manage it. And it's very difficult to manage
Well, I
and,
think
and,
that
to,
that's the
and to reverse, as we say.
Well, I think that's the point, is that we are not sitting here as two mature adults, psychiatrists who are saying, well, we think it's a bad idea. I mean, the consequences are very real. One sees them in one's clinical practice and one hears about it, but the data is there. The research is there. And I think that for any parent of an adolescent, of a child, access to social media, one has to be cognizant of these things. But then, of course, it speaks to another issue, which is the communication around sexuality within the home, parent-child, where one has a sense of what is appropriate,
Yeah.
what is acceptable, what is normal, without, laying rigid boundaries, but the ability then to kind of contrast and compare and sort of weigh and measure and say, wow, what is this? Okay, wait a sec. This doesn't conform to what I've understood, and what I've been made to understand is how things should be. And I think it's not easy for parents to necessarily navigate that terrain. Your
Yeah.
thoughts in terms of
Yeah.
what you've seen?
Yeah. I mean, I think it, again, as you've said, depends on the context. So obviously in some contexts, it will be something that's talked about, and it'll be an easy thing to express and talk about. But in other contexts, it will be very difficult, and it may not be spoken about at all. It may not be a subject or a conversation that can come up at all. Dating and that sort of thing might not also be
Yes.
something that is allowed to happen. So then you think, well, then schools, or do they have a role? And I think the development of LO,
Life
life
sciences,
orientation,
life
yeah,
orientation,
life,
yes.
yeah, yeah. Um, should be somewhere where those sorts of things can be discussed and explored with a neutral adult who's non-judgmental, even if they don't get such an opportunity at home. And maybe it's easier that way, but I think there's a bit of pushback against that, again, for the same reasons. That people are uncomfortable with it and uncomfortable with discussing it,
Well,
or having,
Well, I suppose it raises the issues of where parenting stops and ends, and where the school steps in, and who's communicating this kind of information to the children. So
yeah,
yeah, that's a contentious issue. But I'd alluded to neurobiology earlier, and I'm going to come to it now, because it's really interesting when you look at the actual. I mean, we're talking behaviorally, but I think when you look at the actual impact on the brain itself, so here we're looking at objective measures of what changes as a consequence of exposure to pornography. And
yeah,
here we're talking about an evolving, developing adolescent brain.
yes.
So your comments on that, Linda?
Um, well, I mean, I guess it pathological compulsive behaviors do share a lot of neurobiology or neural processing with addiction, and it relates to the reward center, which is involving the VTA, the ventral tegmental area, and the nucleus accumbens. Um,
Yes.
and these areas also are important in risk taking and impulsive behavior too. So if you look at all the addictive disorders, um, you get you get those features, and in a way, um, sexual addiction, if you want to call it that, behaves in a very similar way, and it seems to also um, show up in the same ways on MRIs and functional MRIs as the addictions do too, which
That's
is
interesting.
really important. Um, in terms of what it's doing to the developing brain.
Well, I mean, I think that both of those brain areas you mentioned, the ventral tegmental area and the nucleus accumbens, are responsible for the secretion of dopamine. So it's all linked around dopamine and reward and pleasure. And, you know, a lot is made of dopamine, and it's not just about that. But I do think
Mm,
that those are key. Those are key areas. And it seems that pornography seems to activate those areas, causing that
mm,
dopamine release. And then one is
yes.
looking for it. And then we get into the addictive component. And so, coming back to what we'd said earlier, addiction, compulsion, I mean, it all seems to be pushing in the direction of a form of addiction, actually. I'm not saying it is, but certainly if one looks at the brain changes and what is going on. But I suppose,
But just to interrupt you there as well, just to say
yes.
it, I mean, if you look at excessive digital media use, not necessarily pornography, it also behaves exactly the same way as addictions do in the brain in terms of the reward circuitry and, the functional MRI studies. So again, that's just digital media use. Also behaves like an addiction.
Well, now that's kind of interesting because at the end of the day, we're talking across the age span. That's for everybody, actually. And how this device is impacting on our brains without us necessarily realizing it. But I think anybody who's a doom scroller on Instagram will know, and I count myself among, I had to actually stop myself. I've mentioned on a previous podcast, it's sort of Instagram or the algorithm picked up that I like cats. So I was getting all these crazy cat 3-minute or 2-minute or 60-second hits, and I would go through and say, wow. And then I thought, no, hang on a sec. Half an hour later, what the hell are you doing, man? Stop it.
Yeah.
So I've stopped it. I don't doom scroll anymore because at the end of the day, it's impacting you and it's having an effect on your brain. So now I'm thinking, what about the adolescent brain and the adolescent brain that's already compromised to some extent with ADHD? It's really profound. And I mean, again, also the frontal lobe and the prefrontal cortex, which is your control center. What's going on there?
Yeah. I mean, I think, it sort of it induces the addiction sort of circuitry in those areas. And then with continued use, you get neuroplasticity, which is very worrying because then
Let's
you
explain.
become so essentially you almost become desensitized to it. And you may need more in order to state the same responses that you had before. And this, then of course makes it continue. You makes you continue in trying to get more and more of a hit.
I think that is an issue, right? The desensitization and almost the craving and the need. And so you just get deeper and deeper and deeper into this loop, which is kind of self-perpetuating.
Yeah.
So yes, very troubling. But
Yeah.
and I mean it. I
Yes,
mean,
there was
really.
one study which showed that, if we think that putamen activation occurs during sexual arousal, and in this MRI study, they found that the left putamen showed lower activity in response to sexual urges. And they proposed that this decreased activation represents a tolerance brought about by desensitization, which means that you then need more, as I said.
Again, it's kind of pushing us in the direction of addiction without necessarily calling it that. But I was just thinking in terms of defining adolescence, I mean, frontal lobe maturation is probably also a manifestation of adolescence. And I can recall when I was in the adolescent unit reading that the adolescent brain or the brain kind of only matures in the early 20s. And it's kind of interesting in America, 21 and under, not allowed to drink. So I don't know what they knew, but certainly it's an interesting correlation in terms of that ability to control. So given all of the difficulties that we've outlined and all of the need for concern, what is to be done? So this is where I'm going to call upon you as a child and adolescent psychiatrist, in terms of, okay, so what do we do now?
So, I mean, I guess the first thing is to be aware of it and to be aware of the link and not between ADHD and both screen addiction and pornography addiction, and not to forget to include that in your history and mental status, etc., so that it's there and you can talk about it and you can bring it out into the open, maybe not with the parents there, but at least so that it's not missed and it is something that becomes something that you can talk about, that there's not so much shame and embarrassment around it, that if it's excessive and if it's affecting your quality of life, then we need to think about it. And we need to find ways of helping you to manage it and helping you to maybe reverse some of the behaviors like we would do with any other condition. But I think if you don't ask about this in adolescence, it won't come up unless the parents have picked it up, or there's been some sort of a consequence of it. So just to
Yes.
keep it in mind,
Well, I
I
think
always
that
ask about
that's.
screen or
Sorry, just say
screen
that
use.
again.
And I said, I always, it's part of my history to ask what are the rules around screen time and, from the child. And often they say there are none, and the parents quickly jump in and say, oh, yes, yes, there are. But it's a sort of yeah, there's not always that much of a screen time rule. But the pornography thing is completely hidden and secretive and shameful. And so you're not going to get that easily unless you really are, sensitive and probing around it.
Well, I think that that's one of the big changes that has occurred in child and adolescent psychiatry as part of the clinical assessment, is that we are needing to think about and building into the assessment process that kind of line of questioning just as a routine, and starting out with how much time do you spend on your phone per day, which maybe gives us an in into further exploring, oh, so what do you watch and what interests you? And one moves from there, so you can actually get to it through that. But as you say, it's about having an index of awareness and being willing to actually go there, just to explore and see where that takes you. I think one of the issues for me, and your comment on this, with a kid with ADHD and potential excessive pornography usage, are we looking at the need to further optimize their treatment for ADHD as an intervention strategy?
I mean, possibly yes, but as we know, with most of the ADHD medications, they only really work during the day, except obviously for atomoxetine, which works 24 hours a day. So if the ADHD meds are helping a lot with the impulse control and emotional regulation during the day, they're not doing that at night. And that would be the time where the child, might have access to these things. But definitely we would want to maximize and optimize treatment of ADHD, both from a pharmacological point of view, as well as maybe from an executive functioning point of view. And, so with an executive functioning kind of coach or an OT, helping them to manage all of these things, which are really, impulsivity and disorganization and those sorts of things. And novelty seeking too, which is a big part of the impulse control. So yes, definitely to optimize the ADHD, and I guess to involve, the family or the parents to an extent too, in terms of helping with some limit setting and some filtering of devices, or blocking, or putting on some screen limits.
Well, I think that the
Yes.
involvement in the parents, involving the parents is
Yeah.
is for me critical, assuming the parents are available, accessible, and amenable to getting involved. But of course, the governments have started to step in. So I want to come back to Jonathan Haidt. And so I came across in 2023, so a little while back, I was reading an article, and for some reason I printed it because it dealt with the issue of smartphones, and are smartphones destroying this generation? So without going into the detail of the article, he had 4 rules that he mentioned, and I'll appreciate your comments. The first one is no smartphones before the age of 14, no social media before the age of 16, no phones in schools. His 4th rule was that he felt that kids needed to spend more time together and less time with adults. We'll park that, just focusing on the first 3. And it's kind of interesting because these first 3 things that he've mentioned, thinking about the Australian government introducing a social media ban for, I think it's either under 16s or under 18s. I would need to check on that. 16, and then a report that I've seen where up to 60% of those kids are bypassing the government ban. So your thoughts on what Jonathan Haidt had to say?
I mean, I agree with all of those points that were made, and I would probably add one more for me: no
Yes.
phones alone in bed at night or at night, because
Yes.
that's the worst in terms of doom scrolling, activating things that you may not have done at another time. So I agree with all of those, and I think we all survived without a phone, and I get it now that these children are embedded digitally, and that's what they know, that's what they've been born with and they grow up with. But I think that we do need to put more safety guards in place in terms of social media in particular. And you don't need a phone at school. If you want to go and want to phone your mum, you can have a little burner phone that you can send a message if need be, or you can go to the office. So I think that I do agree that these phones are affecting interpersonal relationships. They're affecting social skills. They're affecting mood. They're affecting anxiety levels, and they're affecting concentration levels. There's quite a few studies looking at little children on screens and what it does to their focus.
Which I suppose brings me back to the extent of ADHD diagnosis. And coming back to what you said originally, what's changed? This has changed. Social media, electronic media, handheld devices, access, availability. But I was thinking about the whole government stepping in and regulating. Where does that put parenting? Does it make it easier for parents, or are they stepping in where parents are not acting as they should? It's a question about parenting.
I mean, I think it's probably a bit of both, huh? It
Yeah,
depends on
well,
the level of involvement of the parents, and maybe education level, and I don't know. It's a complex one, but I think it's probably a bit of both.
yeah, I think it is a complex one, and one doesn't want to remove parental agency, but by the same token, if it's not happening, and we do understand that there's a societal risk, because that's what we're talking about, a society. And I mean, I'm thinking, and your comment on this, I mean, this is the future generation. where where are we going if this is what is happening, and we know we've got the data, we know what's happening.
Mm, mm.
So how do
And then
how,
you
how do
see,
you how do you feel about
yeah.
that?
No, I feel really worried, and if you haven't watched the series Adolescence, I would strongly advise you to. It's very frightening, and we don't know what our children are being exposed to and what they are identifying with, and how they're finding agency in certain ways of thinking. It's very worrying.
Some might say that we're coming in a little bit late, but I think better late than never, because I think that, as with all new technology, only time teaches us the good and the bad. And I think that we're not saying we're going to throw the baby out with the bathwater, but we are saying, at a vulnerable time, one has to say, what is the fit between technology and the developmental age? Without being draconian, I mean, that is a question, right?
It is, and I saw an article on one of the Nordic countries who has backtracked on using iPads and only technology and only textbooks online, and they've gone back to paper because they felt that their children were not learning as much as they did when they were writing and when they were looking things up, as opposed to just online. It was a very interesting article, I must say, from a very first world country.
I must say that evokes a conversation that I had with a headmistress of a girls only school, and she was adamant. Pen and paper, because she said that the best way to concentrate in class and to focus, and this was many years ago, this was with the introduction of electronic media, and she was adamant that you are activating different parts of the brain, and it certainly facilitates more effective and efficient
Mm.
learning and concentration. And yet, in the name of progress, we've moved away from that towards electronic media. And now what's really interesting is that you're saying, the data, or should I say the experience in certain Scandinavian countries who are generally quite progressive, is saying, let's
Mhm.
let's
Mm.
backtrack.
Yeah. And now we've got AI to contend with, which I think is a whole nother next level.
Well, I have, for me, AI is about awe and fear. It's that kind of combination of feelings in terms of artificial intelligence. And I think that, as with any new technology, and I suppose it's the same with any new drug, it's usage which shows you how it impacts both in terms of benefits as well as risks. And I suppose when it comes to social media and electronic devices, I think we've got that information now and we've got that data. And I think that at the end of the day, as a parent, this is where you need to be thinking very carefully about how you operate. And I think at certain schools, the parents have come together and they've collectively, as opposed to individually, but collectively said, you know what? We need to develop a policy. What's your experience of that, Linda?
So there definitely are some schools, and there's a couple of organizations who organize this and do talks, who have done it, banned as phones at school or whatever the case may be. I don't know that you can always control it and control it at home, but at least if school is a place where you're there for a large amount of your time, if it can be something that happens there, that's quite a few schools are thinking about that and doing it. Yes.
Well, I think
It's a good idea. It's really distracting. There's more, there's more bullying. There's more, I don't know, more anxiety. I think anxiety is the big one that always strikes me. How much anxiety the screens engender in kids.
Absolutely. Well, it's something which needs to be dealt with. I think we've got the information. Parents need to come together, I think. I don't think that it's an issue that we can look away from because it's impacting the future generation. So I'm not nihilistic. On the contrary, I think that we've arrived at a point where we have information and we now need to use that to empower ourselves to actually act in a way that's in the best interests of the child. Linda, I want to thank you for your time and for joining me and for sharing of your knowledge and experience. And at the end of the day, I think we're ending on a note of hope, actually, and potential for change, and not saying, oh, well, there's nothing we can do. I don't accept that. Your final thoughts?
Yeah, I agree with you. I think we do need to be very cognizant and aware, and I think that's happening, and that's good. And hopefully that will stand us in good stead to manage the next wave of technology, because we now have the knowledge and we know we've got research and we've got years to see what it's done. And we've got people like Jonathan Hart's book, which is really worth reading.
Just mention the title again.
It's called The Anxious Generation, Rewiring the Brain.
Yeah, so that's a recommend. I've actually seen him interviewed on various YouTube clips, and he's quite impressive, and and he's compelling. Linda, take care. I look forward to seeing you again, and thank you so much for joining me. Cheers.
Pleasure. Thanks. Bye. Thanks, Chris. Cheers. Bye.
Bye. Thank you for joining me for this episode of Talking Psychiatry. As always, please feel free to comment and do subscribe. The next episode will be the final episode for this season, and will see me in conversation with Mark Goldblatt talking about adolescent suicide. Until then, do take care.